Did you know you can test hypertension with only a drop of saliva in Zambia? Welcome, Salivarian. Innovation in every drop. 2 months ago in Lusaka, a 29-year-old Baba man collapsed on his way to work. No warning, no symptoms, no second chance. He felt healthy, he looked healthy. Little did you know that he was carrying his blood pressure was rising every day. This is a story for many millions of young adults living in Zambia. Over 1.3 million of people are affected with hypertension, and 572,000 are affected and are aware of their hypertension status, while 728,000 people that are affected are unaware and they are not controlling their BP as well as the risk that they carry. And according to 2019 statistics and data, it shows that Zambia records about 8,700 deaths each year that are linked to hypertension. Why is this so? Because of lack of early detection tools that are not invasive. People mostly fear to go to the clinic for testing because of the painful procedure that they have to go through, drain of blood, and so on. The other point is because it is expensive, considering that they have to travel from their place to the health facilities for them to get tested. The other point, it is time consuming. Most people, considering the fact they have to travel to wait and queue in lines and for them to be examined, also considering the time that they have to spend going back home. That's why we introduce you Saliva Smart. This is an AI-powered device that uses saliva to detect the presence of hypertension early. The steps that the user must follow: one, the user must spit small amounts of saliva on the Saliva Smart strip and wait for it to react, and the color changes. You get your smartphone, you capture the image, send it to the Saliva Smart app in your phone, and you wait for 3 to 5 minutes for the app to tell you the result, whether it's moderate, high, or low. When it's high, you're supposed to go for further testing, and when it's low, you're good. When it's moderate, it's going to give you some health tips on how to keep yourself on a safe track. Why is it a good call for action? It is non-invasive, it does not require needles, going to the clinics or labs, and it's pain-free. And then when we talk about fast, it's going to be able to reach the results within 3 to 5 minutes, and it is easily portable. You can carry it in your purse, in your bag, in your school bag, anywhere at any time. It is affordable. It's going to be sold at 15 to 20 kwacha each strip and 80 kwacha for monthly packs.
Business model, it will have saliva test strip costing 20 kwacha to 35 kwacha per strip. Mobile app subscription, it will also include partnerships. Our target market will have the primary target market. We will target the adults aged 18 to 65 and also those people who are at risk of having hypertension. Our secondary target markets are clinics and also non-governmental organizations. Why now? Urbanization is rising rapidly, increasing hypertension risk. Healthcare system are burdened. Early detection is cheaper and easier than late-stage treatment. Traction and validation. We have gained strong traction through program recognition, which shows that our idea is already being noticed and appreciated. We conducted user interviews and the feedback confirmed that the problem is new and our solution is needed. We also received expert support which strengthened our confidence in the direction we are taking. And last, we have seen clear market signals that shows a growing demand for a solution like ours. Meet our team. Together we bring medical knowledge, community insight, and technical skills to make this solution possible. Our ask is simple. We seek funding, meaningful partnership, and pilot partners who can help us test and scale our solution. Our next step: in the next 6 to 12 months, we aim to finalize lab validation of saliva biomarkers for hypertension, build and test the field-ready saliva testing device, train community health workers to use the solution, demonstrate